everyone, this is Dr. Ananya. Welcome to my channel. In today's video, we'll be talking about creatinine clearance test. Before beginning the video, I'd like you to subscribe to my channel so that I can share all the valuable and useful information with you. First of all, let us know what is this test. A creatinine test is also known as serum creatinine test. It is a test that tells how well your kidneys are functioning. Creatinine is a waste product that comes from the breakdown of the muscle. As your body makes creatinine, it is filtered through kidneys and expelled through urine. Your kidney's ability to handle this creatinine is known as creatinine clearance test. Also, this helps in telling how fast is the blood moving in the kidneys, also known as GFR, that is glomerular filter rate. This test is done so as to check how well your kidneys are functioning. Most of the times, this test is not done alone and is a part of renal function test. Your doctor can also order this test if you show any symptoms of kidney diseases. Some of the symptoms of kidney diseases are feeling nausea, vomiting, low appetite, problem in sleeping, joint pain, and swelling in joints. Now let us see how is this test done. This test can be done in two ways. It can be done using urine or it can be done using the blood. If you are taking the blood test, then a small sample of blood will be withdrawn from the vein of your arm. The sample will be then collected and sent to the lab. The results usually come in 2 to 3 days depending on the lab. If you are taking the urine test, you'll be required to collect a 24-hour clean sample. Make sure you follow all the instructions given by a doctor while collecting the sample. So, how can you prepare for this test? There are no special preparations needed for this test, but you must avoid eating cooked meat 24 hours before this test. Also, make sure you inform your doctor about all the medications that you are taking, including the OTCs, that is over-the-counter pills, supplements, and any other herbs. Are there any risks or side effects to this test? There are almost no risks or side effects to this test. But make sure while taking the blood test, the needle is sterilized and the area is well cleaned. And while taking the urine sample, make sure you wash your hands carefully and thoroughly. Now, let us talk about the results. What may the results mean? The values for this test is usually measured in milliliter per minute. It is different for both women and men. The normal values for women are 95 milliliter per minute and the normal values for men are 120 milliliters per minute. Usually, a lower than the normal value is considered abnormal and indicates a problem. So if your value is lower than 95 if you are a woman and if it is lower than 120 if you are a man, then these indicate a kidney problem. If your values are not normal, it may not necessarily mean that you have a health condition. Sometimes diabetes and high blood pressure can also lead to low result of clearance test. Your doctor might require additional tests or might require to repeat the test to confirm the diagnosis. So, it is important for you to talk to your doctor or consult your doctor before you start any medication or before you interpret your report. It is equally important for you to get tested from a reputed and reliable lab. A link to a reputed and reliable lab will be provided in the description below. If you have any questions or any suggestions, feel free to comment down below. Till then, stay safe and stay healthy.